of my day-to-day is to take care of my patients. My initial evaluation covers a ton of education on all of the balance systems and how they integrate together so that they have a general idea of the things we'll be doing in physical therapy. I'm the one that creates the plan of care with the patient. I want to know what the patient's goals are. Their issue may be, I'm having trouble walking. Well, tell me about your life. What have you done? What was your employment? What do you like to do? You have to consider all of those when you're looking at a patient. So here at Orthopedic Imbalance, we specialize in vestibular imbalance patients. Vestibular patients can come from a whole host of different things. There are central origin issues, which mean they stem from the brain and the spinal cord. There's peripheral vestibular issues, meaning usually an inner ear dysfunction or disorder. And then balance in general can come from all sorts of things. When it comes to Gail, she is very complex.
What brought me here is I was in a car accident in March. And since the car accident, I was having pretty bad headaches, dizziness, imbalance issues. I started therapy here in May. At that point, I was diagnosed with the rocks that are in the ears, which is BPPV.
Sometimes those dislodge and they go into the canals of the inner ears that help detect where we are in space and our balance and equilibrium. And when those move in the canals where they shouldn't be, that causes the spinning sensation known as vertigo. So we treated her first to take care of the BPPV because vertigo is very debilitating. She did really well. Once we calmed that down, she was able to take off more with the balance issues, neck issues, low back issues.
So I've really come a long way since May, to be honest with you. I sort of have this shirt on that talks about fairy tales coming true because for a while there it was a little scary because I didn't know if I'd get back to what I was.
She's a healthcare professional and she wants to get back to work. That is her primary drive. Just like us, she loves helping people and treating people.
It took me a while to be able to get where I'm at because I would be pretty dizzy and off balance, but I'm doing a lot better now. So that's really what this has done for me.
With Chris, she had a very similar presentation initially. She had the bilateral BPPV, which means on both sides.
So that was, really bad with getting up out of bed. You're falling over. You're just extremely dizzy.
Vertigo completely gone within a couple of sessions, which is awesome. Love when patients respond that way. That's the coolest part about vestibular physical therapy is when you can treat BPPV and it makes such an impact in that short amount of time.
I have improved tremendously, and that's all because of Nicole.
Larry was a totally different approach. He was a straight balance patient. He didn't have dizziness, no vertigo, no nausea, anything like that. His imbalance was a complication from lower back surgery.
I had problem with balance. I could just walk one speed. I was always trying to catch up to myself. And I couldn't make turns. And I had a very difficult time with stairs.
So we worked a ton on foot clearance, getting his feet working again, strengthening of the ankle muscles.
I've made a lot of progress. When I came in here, I couldn't hardly walk a straight line. I could only walk one speed. Now I can walk slow, intermediate, walk fast. I can make the turns. I can go up and down stairs without hanging onto a rail even.
Larry was always fun to work with, but at his graduation day, he teared up. And then I teared up because I was not expecting that at all. It always, always touches you to see how much you've helped improve their life. Physical therapy has to be one of the most rewarding jobs there is. Sometimes we don't really realize how much of an impact we make until that graduation day. We would love to see you here at OPTS for any orthopedic or balance needs so that you can become part of our family.